Let's talk about something that's quietly changing everything in healthcare. For a long time, medicine was kind of a one-size-fits-all deal, but that's all starting to change. We are now stepping into an era where data is creating hyper-personalized care, and that means better outcomes for pretty much everyone. So, how does it all work? Let's dive in.
Okay, I'm going to start with a number that should absolutely stop you in your tracks. 97%. You want to know what that is? Until just recently, that was the percentage of data generated by hospitals that went completely unused. Just think about that. A huge ocean of potential insight just sitting there, totally untapped.
And that really gets to the heart of the problem here. We're sitting on a data goldmine. This isn't just a missed business opportunity, it's wasted insight. It means we're missing chances to improve patient care, to make our hospitals run better, to basically make healthcare work better for all of us.
So when we say data-driven healthcare, what are we really talking about? Well, at its core, it's pretty simple. It means we're making decisions based on actual evidence, not just on gut feelings or tradition. It's a huge shift from, well, this is just how we've always done it, to, okay, this is what the data tells us works best. The whole point is to guide every single action with facts.
Here's a perfect example of what I mean. And it doesn't have to be super complicated. Imagine a dental clinic has really long wait times. Instead of just guessing, they look at their appointment data, and boom, a clear pattern emerges. They're swamped between 4 and 6 p.m. So the data-driven solution is right there. Add another dentist during those hours. It's simple, it's effective, and it solves a real problem for patients.
All right, now let's see what happens when we take that same mindset and apply it to marketing and healthcare. The benefits are just huge. And believe me, it's about way more than just running ads. It's about connecting the right people with the right kind of care at the exact moment they need it.
First up, patient targeting gets so much better. Vastly better. By looking at things like demographics, medical history, even behavioral patterns, providers can stop just shouting into the void with generic messages. Instead, they can craft really personal messages that speak directly to what a patient actually needs. And that, of course, gets way more engagement.
Which leads us right to our second big benefit, way better patient engagement. Think about it from your perspective. When you get a message that's actually personalized for you, like a reminder for a specific screening that you're due for, it empowers you, right? It helps turn you from just a passive patient into someone who's actively involved in their own health, and it really strengthens that crucial trust between you and your doctor.
And of course, we've got to talk about the bottom line. Data shows you, in black and white, which marketing channels are actually working and which ones are just wasting money. This lets healthcare organizations put their budget where it's going to have the biggest impact. It means less waste and a much higher return on their investment.
Okay, so this all sounds great in theory, but where's the proof? Right? Let's look at some real-world examples where data isn't just some buzzword, it's actually delivering incredible results right now.
We're going to check out two really fascinating case studies. The first one uses operational data from X-ray machines to solve a really expensive problem. The second one dives deep into clinical data from electronic health records, or EHRs, to actually predict patient risk. Both of these show how totally different kinds of data can lead to some seriously powerful improvements.
So first up, the X-rays. A clinical team found out that a staggering 25% of their images were being rejected, a whole quarter. So they dug into the data. They analyzed why images were getting rejected and found clear patterns. It was all tied to things like image quality and how patients were positioned. So what did they do? They developed software to help guide the technicians, fixing the problem at the root and making everything more accurate.
Now, for the EHRs, this one's really interesting. Researchers wanted to figure out who is more likely to need a second surgery after a knee replacement. So they analyzed all these lifestyle factors that were already in the patient's health records. They found key patterns, and this allowed them to create personalized recommendations, helping both doctors and patients make smarter, more informed decisions before that first surgery even happens.
So, we've seen the why and we've seen the what. Now, let's get to the how. This next part is a clear, actionable blueprint for any organization that's ready to start making this transformation for themselves.
And here it is, a 5-step plan. It all starts with step 1, define your goals. You have to know what problem you're trying to solve. Then, step 2 is to integrate your data sources. You got to get everything into one place. That leads to step 3, breaking down silos, so different departments are actually sharing information. After that, you can do step 4, invest in the right tools to make sense of it all. And finally, and this one's huge, step 5, foster a data-driven culture. Make this the new normal. It's a clear path from just having data to making great decisions.
Okay, but before we even think about that blueprint, we have to talk about the absolute foundation of this entire thing. And that foundation is trust. Because handling sensitive patient data isn't just a technical problem. It comes with a massive ethical and legal responsibility.
There are some major legal frameworks that govern all of this. In the United States, you've got HIPAA. Over in Europe, it's GDPR. And underpinning everything is the simple idea of informed consent. But really, it all boils down to one critical thing. Patients have to be in control, and they have to clearly understand exactly how their data is being used. These are not suggestions, they are non-negotiable rules.
Building, and just as importantly, keeping that trust takes constant work. It means only collecting the data you absolutely need. It means being totally transparent about how you're using it. It means having rock-solid security, like encryption. And it means checking out every single partner you work with to make sure they're compliant too. Every single step is a chance to prove you deserve that trust.
Which really brings us to the big final question. You've seen the potential, you've seen the real-world proof, you understand the ethical lines, so now you have to ask, what is the very first step your organization can take to get on this path?
The answer, thankfully, is simple, but it's really powerful. You don't have to boil the ocean here. Just start small. Pick one specific, manageable problem, like that dental clinic's wait times. Measure your results, prove that it works, prove the value, and then you scale your strategy. That is how this revolution really happens, one smart, data-driven step at a time.